we wanted to make sure we thanked our sponsors. So, Aubrey, if you want to show up that slide, we can't do what we do without them. We're very honored to have our education events presented by West and Merck and Daiichi Sankyo, with our supporting sponsors of GSK, Lilly, Gilead, Pfizer, and Immunogen, that is now a part of AbbVie. So very, very grateful for them. And we do well over 50 speaking engagements now, I feel like a year live, and we're able to do that because of this fine support. Perfect. So I think we are ready to introduce our guests. What do you think?
I think that's perfect. Well, first
All
and
right.
foremost, we have Lorenzo Cohen, PhD. He's the Richard E. Haynes Distinguished Professor in Clinical Cancer Prevention and Director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center in Houston. He's a founding member and past president of the Society for Integrative Oncology and a former vice chair of the Academic Consortium for Integrative Medicine and Health. Dr. Cohen has published more than over 200 scientific articles in the top medical journals and has edited 2 books on integrative medicine and cancer care. We also have Alison Jefferies, MED, is a nationally board certified wellness coach, author, and educator. She works with individuals looking to make change in their lives, including people facing cancer diagnoses and cancer caregivers. Alison has also worked extensively as an educator. She works closely with Lorenzo Cohen to foster health and wellness in individuals and their communities. Cohen and Jeffries live in Houston with their 3 children. So please join me in welcoming our guests and authors, Lorenzo Cohen and Alison Jefferies.
Well, good evening, everyone, and we're thrilled to be back with this organization, Unite for Her, and thank you, Sue and Aubrey, and all that you do to be able to support the community, bringing these really necessary services, and we're going to talk about some of them tonight. So we're just thrilled to be here.
So I thought it might be great, as we're talking about stress tonight, to actually take a moment to do some breathing and practice some of these stress reduction techniques that you might already do or be considering taking on. So if you're comfortable doing it, wherever you are, whatever position you're sitting or lying in, just closing your eyes if that's comfortable for you. And taking just normal breaths in and out, putting your focus on the inhalation and the exhalation. Honoring this moment and this time that you've dedicated for your health. Feeling your body relax and sink into its position, letting go of everything that has come today, this week, last month, just releasing it. As as thoughts come and go, just watch them float by as if on a stream. Not holding on to them, acknowledging them, and watching them pass by. Coming back to the breath. Inhale, exhale. We're going to take 3 deep breaths together. These breaths get progressively deeper as you're able to bring the air deep into your diaphragm and your belly. When you're ready, inhale, hold, hold, and exhale. Extending that exhale for as long as you can. Breathing normally between these breaths as you bring in healing energy and light. When you're ready, inhale for your second deep breath. Inhale. hold, hold, and exhale long and smooth. Feeling your body settle deeply into this moment. Last breath. When you're ready, inhale, hold, hold, and exhale long and smooth, releasing all that air. Take a few moments to breathe normally, and when you're ready, open your eyes and come back. Are you back with us?
Yeah, no, I always go so deep so quickly. It's amazing.
It is amazing what you can do in just a couple of minutes, how it really, you can step away from your life and how cleansing and cup emptying that can be.
And there's a whole physiology to what we just did that I will get into a little further in our talk.
Okay, we're going to share our screen. Today, we're talking about stress less, fostering calm and resilience in everyday life. And Lorenzo is the scientist, and I am the educator. And together, we are going to talk about one aspect of anti-cancer living, and really stress and lifestyle. So Lorenzo will present the research on stress and lifestyle, and I'll talk to you about some possibilities that you might consider bringing into your life if you're looking for ways to reduce your stress or deepening a practice that you might already have. We wrote this book together as a result of, Lorenzo's work at MD Anderson Cancer Center and my work as an educator, and us taking on the challenge of educating our children, our 3 kids, and wanting to fill their toolboxes with things that were really valuable about how to live a healthy life. And we realized we weren't doing it, and then started making change ourselves and speaking and bringing our perspective to this topic. And wrote the book Anticancer Living. And thank you so much for those of you who've taken an interest in it, and that it's available if you have family in other countries or who speak different languages and would like to read the book. And so on the day, and many of you may know this, but on the day that we submitted our final draft of our book, Lorenzo was diagnosed with advanced cancer. And we went from husband, wife, scientist, educator to cancer patient and cancer caregiver. And so, it was obviously, like you all know, a huge shock and a readjustment. And, time was necessary to kind of get ourselves reoriented. And one thing that we really knew was that the information that we had written about in Anti-Cancer Living was vital to Lorenzo's ability to deal with a cancer diagnosis, to heal to the best of his ability. And I was a partner in that as a caregiver. And so that was, how we moved on and continue to, improve everything that we do in order to be healthy. And the basis of the book, as some of you may know, focuses on 6 areas, what we call the mix of 6. Social support being the first and the most important, which we'll talk about. Stress management coming next, sleep, physical activity, diet, and exposure to environmental toxins. And so today we're really going to talk about social support and stress management. And that when thinking about the mix of 6, it's not that you have to go all in 6 areas. This is the view, and slowly we make small changes across this spectrum. And that results in huge changes about the way in which we live and the ability that we can take control in areas that we can.
But what's important to know is that each of these areas have been linked with, first, the risk of developing cancer, as well as, importantly, being able to control cancer. So for those of us with a cancer diagnosis, all these factors independently and together will decrease risk for recurrence of disease, progression of disease, et cetera. And we don't have time to get into 4 of these areas tonight because the focus today is really on stress management, but we can't talk about any one area without talking about social support, as you'll hear. And we can come back in the future and go deeper into some of the other areas, and I'm sure other speakers will be talking about that. And it's not just also about length of life, it's also about quality of life. And as you'll see from some of the evidence, stress management checks all the boxes in around quality of life and cancer survivorship as well. Equally important, and why these 6 factors are linked with mortality, and in some sense actually all-cause mortality, but here we're focusing on cancer. Essentially, they're linked with all non-communicable diseases and responsible in some shape or form for what would be classified as premature death due to having a disease on board. It's because all of the mix of 6 influence multiple biological processes. And what you see on this simplified cartoon that was published by Hanahan, and there's multiple iterations of this over the past more than a decade, are the key biological factors that need to be activated in our body to allow a mutated cell to grow and thrive. And it's that originally one mutated cell in the body that circumvents certain processes, that grows uncontrolled and develops into a mass that we call cancer. And that's, of course, what ultimately, threatens our lives, travels to other parts of the body, leading to metastasis, etc. And so if these factors are not activated, then that mutated cell is controlled. So a mutated cell, you can just see with one of these examples, I'm not going to go into all of them. The mutated cell knows how to avoid immune destruction. It releases certain proteins into the body. They have processes that allow them to resist cell death. A mutated cell has programming in it that it should essentially self-destruct. But a cancer cell doesn't. It avoids this pre-programming of resisting cell death. They modify the metabolism with the body. They actually grow their own vascular system. Cancer cells release proteins into the body so that they can get extra blood flowing to them. These are just a few examples. And of course, the mix of 6 into some form or another, and in particular stress, as we'll talk about, influences all the cancer hallmarks. So uncontrolled stress within our lives creates a tumor microenvironment that is hospitable to cancer growth. And of course, we want to turn that off. We want to create the flip side of that.
So the mix of 6 really creates a synergy where the whole is more than the sum of the parts. And I think that we're all very familiar with a synergy that is negative, right? We sleep poorly, we get up late, we don't exercise, we don't choose foods that are good, we're not as kind and nice to our partners. So that you create this negative synergy. And what we really want to do is turn that around to create a positive synergy. And the mix of 6 can do that because it's comprehensive and it's yours to work with. It's dynamic and fluid. And, it's not about blame or shame or guilt, or it's where you are right now, today, in this moment and stepping forward. It doesn't mean that you don't circle back to address things that you want to address, but it's really about stepping forward with support.
And, it's great that we're focusing more in depth just on the area of stress, because stress is really the saboteur of all our good, healthy intentions. Not only does it create biologically this more hospitable environment for cancer to grow, but it makes it hard to engage in any of the other areas. And as you'll see, may actually decrease the beneficial effects of all these other things that we're trying to do.
So social support is the most important area to start with because it's critical to have in place to be successful. So support is the backbone on which all other lifestyle changes will either succeed or fail. So often we want to jump right in, right? Okay, I've listened to you, or I've, heard about this or that, and tomorrow I'm going to change everything up. And that is very difficult to do because we jump in, and by lunchtime, people have, at work, people have somebody celebrating a birthday, and then people want to go out for dinner, and all of the kind of things that you may have thought that you want to try and do are sabotage. So really importantly is to back up and say, what do I need to be successful for the change that I'm looking to make? What kind of support do I need in place in order to be able to do these things that I want to do? And so that's what we're going to talk about today.
And support also has more of a direct effect. Here is a paper you can see there just published this year, looking at the flip side, of course, of support, which is loneliness. And Vivek Murthy, Dr. Murthy, the Surgeon General, has an alarm bell out for all of us, where the United States, as well as many other countries in the world, really have this epidemic of loneliness. And when it comes to cancer survivorship and cancer mortality, this is just the most recent paper, but there's many papers showing that even after you control for all these usual suspects, including sex, marital status, education, other health conditions, how long they've had cancer, even mental health, that we see almost this dose-response relationship between loneliness and worse mortality. And this is true across multiple cancers, as well as linked with recurrence of disease. And there's some evidence from a biological perspective, and we're not going to go too deep into the science, of why that's the case. And it goes back to the hallmarks. So what you see on this slide is social well-being, social connectedness along this axis. And here is something called VEGF, a big word, vascular endothelial growth factor. This is what the cancer cells release to create an enriched vascular system. And these are VEGF levels in ovarian cancer patients at the time of surgery. And our close colleague Susan Lukendorf from the University of Iowa has also looked at stress hormones in the tumor microenvironment. A lonely, isolated cancer patient has higher stress hormones in the tumor microenvironment and higher VEGF levels, more vascularization. And here you see the flip side. As social well-being, social connectedness goes up, VEGF levels in the tumor microenvironment go down. So this isn't just about being connected and helping you to achieve your goals in behavior change in terms of social support. It has a really important biological effect as well.
So it takes a team, and everybody needs their own team. If you're a cancer caregiver, you need your team, as does the person who's dealing with a cancer diagnosis. And, your team, in thinking about your team, there are many people. So you have your healthcare professionals who advise you and give you expert advice on your situation. You need to reach out and find somebody who could do your grocery shopping or who could pick up your children. people who can kind of help you doing daily tasks if you need support. Then there's the person who might sign up for a course in yoga with you, who is also interested in exploring a mind-body practice and needs somebody to do it with. And then there is the person who you can share your deepest, darkest, your fears, your joys, everything, but somebody who you really trust and who you can share important things with. But it does take a team, and one person cannot be it. If you have a partner, the partner carries a lot of weight, but it can't be the only person in your life. So very important to think about that, because cancer does not just affect you, but it's a community disease as well. And you want to make sure that you're really well established. And Unite for Her is, right now, you are in a supportive environment. You are part of an environment that supports you and everybody else in this room. And they have tremendous resources to help you participate in things and find people to take that course with and support you to do that.
So let's get into stress and stress management. Let's start with the dark side. Let's start with stress. And as I described to you, stress creates this hospitable environment, unfortunately, for cancer to grow. And there is extensive evidence now showing how that's actually the case in terms of initially the stress response, which is us interpreting things in our environment in a way that ultimately is over that our resources to cope with a certain situation are overwhelming. Now, a cancer diagnosis and any life-threatening illness is, of course, a major stressor. And feeling stress, of course, is normal, but it is something that, as you'll see and we'll share, is important to try and manage it to the degree that it can be managed. Because we know that one of the hallmark symptoms of excessive uncontrolled chronic stress is depression and/or anxiety. And the evidence is really overwhelming that uncontrolled depression and anxiety in cancer patients leads to treatments not working as well and shorter life expectancy. This is just one example of this type of research. Here we are looking at kidney cancer patients, but the same is true. Susan's work in ovarian cancer patients, as well as a lot of research in breast cancer patients as well. Patients who have uncontrolled chronic stress don't live as long. And we understand, again, the biological pathways. And in this study, we actually looked at the tumor microenvironment, looked at inflammatory pathways, immune regulation, and the like. And so the evidence is really just overwhelming. And what that means is there's things that we can do, of course, to reverse that and to create a tumor microenvironment that is not hospitable to cancer growth. As I mentioned, chronic stress activates all the cancer hallmarks. And so this is really something that, on the positive side of this, although it may feel overwhelming, it is one of the few things within the things that are done to us as cancer patients that we can control. We are in control of our response. And the exercise that Alison started with, although it was very brief, that deep diaphragmatic breath actually stimulates the vagus, which is a nerve that wraps around the bottom of the diaphragm. And that's why that deep diaphragmatic breath, extending the belly out, stimulates the vagus. When you stimulate the vagus, you're decreasing sympathetic nervous system activation, which means the stress hormones go down and you're activating the relaxation response. Now, if you do that for 3 minutes, that will happen. Your heart rate and blood pressure will go down. uh, we need to do it for a more extended period of time. And we'll get into some of the details of the different things that we can do to manage stress.
So stress management, stress is killing you. You need an easier job, a smaller house, and a different family.
Well, that probably is a prescription that would work, as many of you may know, but not something we can actually write down for a patient to do.
So before Lorenzo jumps into research that shows, these mind-body programs and the effect that they have and the science behind it, these are kind of the gold standards to go to. There are lots of things that you can do in addition to these, but these really do work and have been scientifically proven to work. So cognitive behavioral therapy, CBT, excellent. One of our the people that we talked to in our book, her friends got together, realized that she needed something, rallied and bought her 3 sessions of therapy because she was having a really hard time and that they knew she needed it. And 20 years later, she still is in therapy and it has been a lifesaver to her. Support groups, that's exactly what we're part of tonight. This is a huge support group in so many different ways. Journaling, simply taking a piece of paper or a pad and writing down just whatever comes into mind. Gratitude. During Lorenzo's treatment, he would do a gratitude journal every night. 3 things that he was grateful for: yoga, Tai Chi, Qigong, meditation, breathing, emotional expression, and expressive arts like music therapy and art, etc. So these are the gold standard. And in thinking about, where do you start with stress management? Very important, while Lorenzo's talking, to think about this, because while your cancer diagnosis has prompted you potentially to make changes in your life, it will not sustain those changes necessarily. And you need to connect more deeply with something. So what are the things that you really care about? If you had to write down 5 things right now that are the most important thing in your life, the thing that it connects to your soul, the reason that you get up in the morning, the reason that you want to be healthy, the reason you want to get your stress under control. What are those 5 things? And people have a variety of different things. So what are yours? This was from from a collection of things that I found with my coaching clients. These were some of the things that were really meaningful to them. And when you're thinking about making that change in stress management and you're hearing about the research and you're thinking, what would be the right choice for me to make? Or am I ready to try something new in a mind-body practice? Why am I doing this? Does it matter that I stay healthy, that I heal, that I, take control and live the life that I want to live?
So, as Alison mentioned, cognitive behavioral therapy is probably the really the gold standard for treating depression or anxiety. There's more, let's call them modern iterations of this. There's now cognitive behavioral mindfulness interventions, acceptance and commitment therapy, and other forms. And I'm not going to go into the evidence in and around that because they're I guess so common in working with psychologists. We are not also by any means anti-pharmacology, and for some people it's really important to have an anti-anxiety medicine or an antidepressant. And in fact, the research is very strong on the use of beta blockers, which are typically used for heart condition, high blood pressure, certain heart arrhythmias. You would use a beta blocker, and what they do is they actually block stress hormones. And there's research to suggest if you block those stress hormones through the use of a beta blocker, you will have an impact also in the tumor microenvironment. Evidence also suggests that these mind-body practices that we're going to talk about, and I'll describe in a bit more detail, yoga and meditation in particular, that they also have a biological effect. There has been, as it says here on this cover, really this revolution in mindfulness and an evidence base that has just exploded over, in particular, the last 20 years, with a lot of funding in this area across hospitals, across medical systems, and really leading, as you'll see, to a change in the guidelines. And this is a paper we published a number of years ago, and just to share an example of how this research was done. This was actually our smaller study. We've subsequently done essentially the exact same trial, but with 450 women with breast cancer undergoing radiotherapy, and this was what would be considered the pilot study. So at the start of radiotherapy, women were randomized, as in the flip of a coin, either to participate in 2 sessions of yoga throughout their 6 weeks of radiotherapy. Importantly, we had this control group that also received that extra attention, but they just engaged in some stretching exercises. And those of you who had to receive radiotherapy for breast cancer know that you're advised to do certain stretching exercises to keep the axilla loose so that you can stay in the simulation position. So those basic stretching exercises, but led by a physical therapist. And then the usual care control group, which unfortunately in many medical centers are essentially just leaving patients alone to do what they do on their own, and not advising them in any way. So the yoga group and the stretching group had 2 sessions a week for the 6 weeks of radiotherapy. They received materials, to continue the practice, but that was essentially the dose, twice a week for 6 weeks. And then we tracked women over the course of 6 months. Here you see a measure of physical functioning, and we're looking at change from baseline, meaning in the week before they started radiotherapy, and this would be 6 weeks later. So, a little benefit, a little improvement in physical functioning in both groups that received an intervention, no change over time in the control group, and really seeing much more benefit for the yoga group versus both other groups, with stretching falling in the middle. So stretching is good, but it didn't create that same effect as this more comprehensive program that we call yoga. If you look at some of these other measures here, general health, really just favoring the yoga group. And a really important measure that comes back to Alison's comment, and if you were to ask me what measure would you want to improve the most, it's probably this one, being able to find meaning in the illness experience, which remained higher than at baseline, even at the 6-month time point. And you see meaning dropping in the other 2 groups. So being able to help people find meaning and purpose in trauma is really quite transformative. We also measured a stress hormone, and this one isn't norepinephrine, but another stress hormone that has a diurnal slope. And in our kidney cancer studies, as well as in breast cancer studies, ovarian cancer studies, a disruption in cortisol, what's called cortisol rhythmicity, where it's high in the morning and then it drops throughout the course of the day. A steeper slope represents better regulation. And we've seen that a blunted slope leads to worse survival. So we collected this at the end of treatment as well as at 3 months, and we see, flipping back and forth here, a blunting in that cortisol slope. In particular, in the stretching in the weightless control group, the yoga group having the steepest slope, meaning better stress hormone regulation, both at the end of treatment and 3 months later. So we're not just helping people to feel better and to find more meaning and purpose in their cancer experience, but also having an impact on biological pathways that we know are going to be linked with mortality. Now, as I mentioned, there's just been this surge in research, in particular in yoga and cancer. And we have a second edition of a book coming out later this year on yoga and healthcare in general. And there's so much research in oncology that there's 2 chapters dedicated to oncology, one for the research on yoga provided during cancer treatment, and then a whole other chapter for the research done in cancer survivorship. There's also been an increase in interest in meditation practice and understanding that, as you can see here, at a neurological level, but also at a biological level. And Alison, I think, mentioned in the list of different things, one intervention which is called mindfulness-based stress reduction, MBSR, which is an 8-week program. It's probably available, I would guess, in almost any of the communities that you live in, because the evidence base is so deep on the benefits of this intervention. And Alison will talk, briefly about our own experience with MBSR. What you're seeing here, just like exercise when you go to the gym, if you are doing weightlifting, after a couple of weeks, you're going to start to notice that your muscles are stronger, and in some cases, they're actually going to be larger muscles. What we see here is after an 8-week meditation program, here you see the controls and change in the size of the hippocampus. So that prior slide shows all this exciting research of looking at how the brain function actually changes. This is actually showing that there was a change in neuroanatomy, and the hippocampus is super important for a lot of things, not the least of which is our memory. And I know all of us want to hang on to our memory as we age. This 8-week program led to an increase in the size of that portion of our brain, and actually a shrinking of the amygdala. The amygdala is the fight or flight center of our brain. So these types of interventions have neurological effect, biological effect, and again, the evidence in particular in and around MBSR, and I'm just throwing a few slides up here of papers, I'm not going to go into the details, are so vast now that it's led to essentially a change in the cancer care guidelines. And here you see a summary of a summary table from a paper that we just published from my group recently, looking at all the evidence based on the guidelines of what authoritative organizations like the National Comprehensive Cancer Network, American Society of Clinical Oncology recommend for cancer patients in and around the use of integrative medicine. Now, if somebody were to say, well, what's the modality that is been shown to be the most efficacious for multiple symptoms, you don't have to go far on this graph to see that it's yoga, meditation, MBSR, right? There's an X in every single symptom-related category. So really something that we argue needs to be part of the standard of care, focusing on these stress management activities. Of course, you see they have an impact on anxiety and depression, but they also impact fatigue, different pain syndromes, nausea, sleep, cognitive function, hot flashes, night sweats. It is the go-to place to be able to help manage symptoms during cancer care and into survivorship.
One of the things I didn't say earlier that I always think about when Lorenzo's talking about how the interior of your body is affected by these practices is that when you feel good on the outside, your cells are feeling good on the inside. And when you feel badly on the outside, you know that your cells are feeling badly on the inside. And that's one of the things to keep in mind. So every time that you take a step that you know feels good for you, it is actually having a biological effect. So this is,
Motto.
the motto of our son's college, his old college, and we were so surprised to see it because we thought, how perfect is this, right? Knowing is not enough. So what's the next step, right? Whether it's your first, your 100th, it doesn't matter, right? Each of these small little steps is very important to moving forward. So how do you start moving forward? So SMART goals are something that many of you, I'm sure, have heard about, but really important when you think about how you're going to do this. So let's suppose that you're interested in meditation and finding more out about MBSR. So you need to think about, these stand for specific, measurable, action-oriented, realistic, and timed. So the first small step that you would make could be something like, I'm going to Google this week where I could take a course like that. And that would be it. Okay, when am I going to do that? I'm going to do that on Tuesday morning because I have time to do it then. It's going to take me probably 30 minutes max, maybe 15. Is it action? So it's specific, it's measurable, action oriented. Is it realistic for me to spend 15 minutes on Tuesday morning? Well, I usually like to do something, or I have to go to work or we have a meeting. So, okay, maybe Wednesday's better. I'm going to do Wednesday and I'm going to do it after work, and I'm going to do it with my partner or with my child or with my mother. I'm going to involve somebody in it, and it's timed. So it's when you think about taking these small steps towards whatever goal you're setting, think about taking them related to the SMART goals, setting yourself up. So each week I'm going to take one small step towards reaching that. Then I find out, is this doable for me? What kind of support do I need to take on this goal? Can I do this online? Do I need to be in person? All of these sorts of things. So one of the people that we talk to in our book, and a really longtime friend of ours, Molly, from where we spend time in the summer off of Lake Huron, she was diagnosed over 20 years ago with a glioblastoma, which is a very serious brain cancer. And she did her conventional treatment, and then 6 months later, the cancer came back, and she realized that she needed to take more serious steps to manage what she was dealing with. And so she took a number of courses, and then she changed the way in which she was living because she realized that stress was a huge factor for her. So her father wrote sticky notes and put them around the house saying, "You are healthy. This illness is not you." Things that she related to. She started doing guided imagery every morning, and she thought about the fish from Georgian Bay swimming out of the water into her bloodstream, swimming out with the cancer, importantly swimming out. And she used meditation. She developed a yoga practice. Her faith was very important to her. But all of this took time, right? By the time that we met her, many years in, she had really worked hard to develop a practice that worked for her.
And she is all in with the mix of six, and is really the poster child of this. And when she heard and we shared about my diagnosis, she sent me this long email and said the most important area is to prioritize stress management. She carves out, at least an hour, if not 2 hours a day. This is not something that everyone can do, but she believes that's why she's alive today. Yes, she eats, a good diet and sleep and all the other areas, but she believes the stress management component is the key to why she's still here after 20 plus years.
Even doing as short, 11 or 12-minute meditation is impactful, and we know that it has results. So, start slowly if that's where you're starting, but there are many ways. Yoga involves movement, breathing, meditation. We took a class with Smitha here, who is a fabulous yoga teacher, with our kids. To try and give them that toolbox and all of us to learn. And then we brought it back, and our daughter would lead the classes because we had learned so much. We, knew what we needed to do, and we did family yoga in our house. Lorenzo's grandmother, this is Lorenzo's grandmother who lost her husband in her 40s. And then this is her in her 80s, and then decided to take on yoga. And eventually, you know, became a yoga master. But you're never too old to do this. And there's so much to be gleaned from it, right? You can feel her calm. You don't ever have to be able to do this pose, but let's all feel what she, you know, that calm. And here, so this is, you know, family meditation. We got up in the morning and we knew it was a priority, and we sat down for as little as 2 minutes to 11 minutes starting. The kids chose the guided meditation, so it was all free online. We involved our family. We also said this is a priority, you know, there was a lot of complaining about doing it. And so we sat down every morning at like 7:25 before we would screech out of the house at 7:40. And then the reality was it mainly looked like this. But we persevered. I don't think that it was incredibly, you know, I felt the stress of it, of trying to manage it and have them, but when, you know, meditating, but what was amazing was to see them really in that space, and to see their bodies relaxing, and to see that they were able to step away from what was going on for just those couple of minutes. And after Lorenzo's diagnosis, and after we had finished treatment, what I realized was that I wasn't handling things well as a caregiver or just as a person in general. And I realized that I needed to do something, that I wasn't handling my stress. And so I asked Lorenzo if he would do the course with me, the MBSR, and we did it together. And we went once a week for 8 weeks. And then we practiced and did our meditations together. So I had a partner, an accountability partner. And we know so many people who've done it with friends or in support groups like this one. And, you know, how you can rally together, or even just to say, for instance, one of the things I did was, I'm going to meditate today to my friend. She said, I'm going to meditate too. And then our responsibility was to let each other know when we had done it. So I had an accountability partner if I had fallen off the wagon a bit and I wanted to get back to it. So there's lots of different ways to do that. So here I've had a lot of free time this year, says the one guy. The other guy is, you know, barely crossing his legs. And so you do not need to be, you know, a gymnast with this. The smallest of movements have the biggest of impacts.
And my grandmother would actually say she could do this pose, which is called the Bakasana, or a variation of a Bakasana. But if she would say that if you don't have time to do the postures, just do the breathing exercises, because it's the breathing exercises that are really at the core of this and will keep the whole body attuned.
So, you know, some other options to think about, right? Journaling every day, just casually writing. Expressive writing is where for 20 minutes in a very dedicated way, you do your deepest thoughts and feelings, things you've never shared. And it's not to share with other people. You can rip it up after you're finished, and really just to do this maybe 3 times over a period of time. Reflective writing, so writing on your meditation, you know, I couldn't stay focused, or I really found it was very helpful when I thought about breathing in light and breathing out negativity. Core values, what are those 5 things that you really identify and are important to you, and the reason why you're making these changes? Writing about triggers and solutions, you know, that grateful journal. People talk about this a lot, and it's really important to make it serious, you know, really recording those 3 things each day before you go to bed that you're grateful for changes the way that you see things. It shifts.
The reason this is important, because evolutionarily speaking, we've evolved from individuals who, you know, I make the argument, had a very sensitive, attuned stress response. The person who was able to reproduce more was the person who was really sensitive to the rustling in the bushes and they could get a head start on anyone else. The person who slept lightly so that they would be able to overcome any of the predators in their environment. And now, we do not live in that same dangerous world. So, but our brain hasn't caught up with us. So our brains are wired to see the negative, to focus on the negative, and actually to see all the beauty and the joy and the positivity in our life takes practice and it takes recognition. And we have to overcome this in some sense, this hunter-gatherer brain that we still live with.
So another thing, and these are all small steps. I often wear a set bracelet, or I carry a crystal of some sort in my pocket, or a rock, so that when I touch it and it's in my pocket, it reminds me, oh, I need to think and be grateful. What can I be grateful for in this very moment that I'm in right now? A special ring or jewelry. Meditation moments. Some of you may do this. So every time you wash your hands, you just feel the sensations of washing your hands. You're stepping away from everything and just in the present, feeling that. At a red light, I'm just going to breathe in and out. I'm not going to listen to the radio or look at my phone or do any of those things. I'm just going to breathe in and out at the red light. And taking those 3 to 5 deep breaths.
And, what we talked about in terms of synergy, and we're just going to be wrapping up now, there's evidence to show that stress will actually, in this case, negate the beneficial effects of healthy food, and let alone the effects of stress on a lot of other health behaviors. This was a really well-controlled study that looked at, they brought people into the lab, fed them a healthy meal, and looked at how the body responded. And they found that people who had experienced uncontrolled stress and more stressors in their lives coming into the lab, they had a biological response to the healthy meal, to a degree that it's as if they were eating an unhealthy meal. So the beneficial effects of stress, the beneficial effects of that healthy meal were diminished because those individuals were experiencing chronic stress. And there's also evidence to suggest that telomeres, which are in every cell in our body and are related to our chronological age. Telomeres are on the end of every single chromosome, and as we age, telomeres get shorter. When the cells replicate, you get what's called chromosomal instability, and this is one risk factor for cancer, short telomeres. And chronic stress leads to short telomeres. That's why cancer, historically speaking at least, was primarily a disease of people of more advanced age. Now, of course, unfortunately, that's not the case anymore. Chronic stress over the course of a year leads to telomere shortening. But what we're showing on this graph here, which is from our book, is that exercise, healthy diet, and a healthy sleep pattern diminishes the effects of stress on telomere shortening. So across the course of the year, the people represented on this line doing all these health behaviors didn't have any telomere shortening. So these 3 lifestyle factors diminish the harms of stress at a biological level. And the individuals who weren't engaging in healthy diet, exercise, and sleep had the most telomere shortening across the course of the year based on the amount of stress in their life. So this is really an example of synergy. The more you can engage in not just the stress management techniques, but also exercise, healthy diet, healthy sleep are critically important.
So it's a practice. Build your team, think about your first steps, and the more that you practice, the better you get.
So think about what your next step is, and we thank you for inviting us here today to talk about anti-cancer living.
That was fantastic. We've had a very active chat. If you go on there, oh, it was so good. It was just so good, and you have just inspired and empowered so many of us on here today. And we do offer MBSR, so we had a lot of our community talking about that and saying, "Oh my goodness, when's the next one? They can use their passport for it." And I was trying to get the information because my staff has done work by now. You know, it's 7 o'clock here on Eastern time. And so I was trying to get information. So I gave you Melissa Christie's email. Many of you know her. She's our senior wellness director. And that way you can email her directly and we'll get the next session dates to you that you can use your passport for the MBSR. So thank you. It was such good data. I can't thank you so much for putting the data and the science with all of these types of integrative, complementary, supportive services that just make such a difference. And we would love to open it up for a couple questions. We're actually over at 7 o'clock, but I know so many people were so excited. And for me, I love that you gave us the flip side. You gave us the opportunity to think about what happens when we do not have good sleep, when we do not eat well, when we do not say kind words, when we don't, like all of those things and how they add up, because we're always talking about doing it, right? Get sleep, work, but the do not happens more often, right? Happens more often, and we don't frame that. And I just thought that was really powerful. So thank you for that. I had a couple notes I wrote down, but yeah. Do we have anybody that has a question for Lorenzo and Alison that we can do quickly? I know we're at our time. Carla, would you like to just unmute and ask your question?
Yeah, hi, thank you so much. First, I'm really enjoying your book. I haven't finished it, but I was at the last session that you guys did as well with Unite for Her, so this is just like awesome. I am an experienced yoga practitioner. I used to be a yoga teacher. I used to have a yoga studio. I have meditation practice. I'm coming onto the tail end of my breast cancer treatment. And my issue is that right now, stress management just feels like anger suppression. And so I don't know if there's like any techniques or any, like maybe I need to like shift my methods, but I just feel like every time I'm doing something, I'm like cognitively aware that I'm like trying to manage my stress. And then it just makes me like more frustrated or angry with the entire situation.
Yeah, so that's a very hard question to address, and situation that you find yourself in, which is also to Allison's point about feeling guilt, that and fear. If I'm not managing my stress well, then one, I'm not doing everything I can to improve my outcome, and creating this vicious loop that you get into, because then you're feeling more stressed about it. So anger issues that you're experiencing, may have, again, something not to do with the stress management per se, and oftentimes more support is needed, and that can come, of course, in very different forms. So oftentimes, yoga meditation practice, clearly, being a yoga teacher, you have an advanced practice, and other things may be necessary, because for you, yoga is more than just a form of managing stress as a teacher. So you may need to add some other modality that you typically haven't done to manage your stress onto your practice. I don't know if that's helpful at all.
That's very helpful. Thank you.
Yeah, thank you, Dr. Cohen. Stacy, do you want to unmute and we'll ask your question?
Yes, thank you. This was very good. I wonder if chair yoga has the same effects as what we would traditionally think of as yoga.
Well, thank you. Great question. So the question was about chair yoga. So we offer, and you saw, the picture that Alison shared of Smitha, who is our yoga teacher at MD Anderson. She's been there for over a decade, and has developed a form of chair yoga, inpatient yoga. We're doing a study now for patients who are undergoing stem cell transplant, and they're essentially doing yoga from the bed. So there's no question that it can be modified and be extremely helpful, regardless of somebody's physical ability. So if you literally can't get out of your chair, you can still do yoga. You probably need to work with a more advanced yoga practitioner, and there's an organization in the US called the International Association of Yoga Therapists, IAYT. And a yoga therapist is different than a yoga teacher. A yoga therapist is required to get at least 1,000 hours, usually takes about 3 years to get that yoga teacher certification, versus the one that I did after I was diagnosed to increase my accountability, which is a 200-hour course. It takes about 6 months. So, for those who have more physical limitations, very important to work and find a yoga therapist, and you can find that through the IAYT website.
And also to add to what Lorenzo said earlier about the breathing work, how important that is. So while, you can't, it might not involve a tremendous
Physical,
amount
right.
of movement, you're still getting something incredibly valuable.
That's
Yeah,
great.
thank
Thank you
you for
so
that.
much.
Hello.
Go ahead, Elizabeth.
Hi, my name is Marisi.
Oh, okay. Go ahead, Marisi.
I just have a question. Sometimes it is difficult for me. I was diagnosed with a breast cancer. It was in stage 1, and it is I have a muted gene that is causing me this, and it is hormonal as well. But I have an issue. I don't know how to let my family or engage them in this situation when my doctor, when my surgeon said it was catch early, so you're gonna be fine. I don't think it's gonna be anything else. And I'm in a treatment that I'm not even sure if it is gonna work or not. And I am having so much stress, and I don't know how to engage my family in this journey with me, because I think even the doctor said that everything is fine when I don't think it is fine with me.
I can hear, I can hear how difficult this is. And it's, not only are you dealing with your own diagnoses, but you're also, trying to figure out what place that has in your family.
Yes.
I, would encourage you to get the support to think about yourself first, and to figure out if there's someone you can talk to about all of this. One of the things in bringing it into the family that I would suggest is that I always say to the kids, and I think that it's really important that you're serious, that you establish a time where you sit down with your family and you say, I want to do things in our house that are healthy for all of us. If I had this, you could say, I had this, I've had this diagnosis, but I'm really doing well. And I want us to change the way we're doing things in our house so that we can all be healthy, and I can continue to be healthy, and you can help me be healthy. So empowering the people you live with to play a role in caring for you, as well as coming up with ideas depending on how old your children are or how old the people that you live with are, is let's brainstorm things that are going to work for us, because there's nobody who is a better expert on what is going to work in your life than you. And that's why, when you hear ideas like we presented, some of them you're going to think, well, that's not going to work for us. But if we changed it a little bit, that could really work in our family. And so I think that you want to empower your family to be part of stepping forward with healthy habits and positivity, and then building your team of support to you know, to work through these difficult emotions and then to be able to participate in those discussions with your family.
Okay, thank you so much.
Well, thank you, Allison. Elizabeth, we'll let you ask the last question.
Right, I don't want to be the last person. Okay, real quick question. I'm kind of a unicorn because I got pneumonitis after my 4th chemo. Do you guys know, given your national renownedness, I haven't been able to find much support for pneumonitis folks. Do you know of a resource I could go to?
I don't. So you got pneumonitis? You got pneumonitis from radiation for breast cancer?
No, I got pneumonitis from my 4th chemo. So I was
From
like
chemo?
hospitalized for a month and then rehab for 2 months after that.
No, I typically hear of this condition as a radiation-induced pneumonitis.
This was the big puppy.
Yeah, wow. No, I don't. I mean,
Okay, that's all right. Thank you.
It's an inflammatory syndrome, as you know. So I don't know. I don't know if
Okay.
you've worked with an internal medicine doctor. You know, sometimes the oncologists don't know how to manage some of the collateral damage that happens.
Yeah,
So
yeah.
working with pulmonologists, etc.
Yeah. Okay. All right. Thank you.
Yeah, thank you, Elizabeth. Elizabeth, I'm going to put it out to our advisory board as well for you. Okay, I wrote your name down so that way, let me see if any of our resources might have some information for you too.
That'd be great. Thank you.
You got it. Well, Allison, Lorenzo, is such a another incredible segment. Thank you so much. I appreciate everything you showed us today. Love seeing the kiddos on the floor. Love seeing what they really look like on the floor when they were doing their yoga. I can absolutely relate to that. But I remember that, you know, when I was sick and going through treatment, I only did yoga about 5 to 10 minutes a day, morning and night. You know, I would do it early and late. It was so life-changing for me to settle my mind, the negative chatter, and because I just could not move well, right? And I used to think you had to be so active and, you know, pull your foot up over your head and wear those cute pants, and that's not the yoga, right? Um, and any amount of time is valuable. So I loved your SMART section, and know that, you know, Unite for Her can help you with a lot of these resources. Just lean in, get the book, right? Really, really understand how important it is, because you do have to take action, right? Wellness is an action. It takes some time, but we're here to help you along the way. We're here to help you along the way. So thank you for your time. Thank you for going over. I know we went over a little bit, and we very much appreciate you being here tonight. We'll come back for another one of your mix and six.
We'd be honored, and thank you so much. And thank you to everybody out there. And we're thinking of you and wishing you the very best in your healing journey.
Yeah, wonderful. All right, everybody. Well, that is the end of our speaker series for today. We are so grateful that you took the time to come and really lean in here. And it's just so nice to hear all that science connected to what we offer at Unite for Her with your Wellness Passport. If you do get a chance, Allison and Lorenzo, take a look at the chat. You have a lot of love in there. So if you get a chance to look at that, that would be great. And Aubrey, how about if you take us to our end here? You'll talk about our sessions coming up for the rest of September.
Absolutely. Yeah. So if you saw that slide at the beginning, we do have a jam-packed month of education. So we have our second virtual hangout next Wednesday, September 18th at 5 p.m., which is with a women's health nurse practitioner. And September is Ovarian Cancer Awareness Month. So we have 2 events highlighting ovarian cancer awareness. We have an Ask the Expert streaming live on Facebook at 1 p.m. Eastern on the 26th, as well as a Her Speaker series on Zoom at 6 p.m. Eastern. So check out our events page for all of our events. We have a lot of great things upcoming. And if you can't make it, of course, check out the Her Library, as well as all of our events are always recorded and posted on our Her Library.
Yeah, I feel like this one's going to get a lot of action.
Agreed.
Aubrey. Agreed. Yeah. Again, thank you to our sponsors. We can't do what we do without them. So our presenting education sponsors are West, Merck, and Daiichi Sankyo. And then, of course, we have support from Lilly, GSK, Gilead Sciences, Pfizer, Immunogen, that is now a part of AbbVie. So we are grateful. All right, everybody, have a wonderful evening. Thank you for joining us. Always good to see you. And Dr. Cohen and Allison, thank you. The best.
Thank
Thank
you.
you.
Appreciate you.
Thank you.
Good night,
Thank you.
everyone.
Good
Bye.
night,
Good night.
everyone.